My name is Dr. Bart Rademaker, and this is the Doctor's Guide podcast, raw and unfiltered. Once again, bringing to you the insights and the action steps that you're going to want to take to help you optimize your health and also to show you the path by which you can better navigate the complexity of all the information out there on the internet or lack of information that you might be getting from the trusted sources that you're totally depending on for your health. And why do I say it that way? Well, here's the truth, in my opinion. We no longer have an excuse to be sick. And this definitely triggers a lot of people because a lot of people have a lot of excuses and reasons why they are sick. But what I really mean by that is that in today's world, and I couldn't say this 5 years ago, but in today's world, we have all the information, we have the technology, we have the brilliant people like my guest here today that can help you and guide you towards optimizing your health. Because the truth is that only 1.2% of all illnesses or diseases are strictly genetic. All the rest, well, it's because of all the other factors and probably bad decisions that people are making every single day. So my point is very specific for today, which is a little different than our usual podcast, because I really want to talk about the challenge to bring forth new ideas that are breakthrough opportunities for optimizing health. And that is why it is a great pleasure of mine to be introducing Peter Simonson, I should say, and Michelle, because we're going to do a role play about the challenge of introducing new technologies out there. Because the truth is that with all that information, most people don't have all the right information to make the right decisions for themselves. And so the normal podcast is just a role play with a particular problem, as well as the guidance from the other person to some sort of resolution, so that you get to witness yourself in the struggle, in the challenge, and the confusion of making the right decisions for yourself. Because ultimately, it's up to you, but you have to find the right people to do that. And all these podcasts out there promoting a product, and oftentimes I'm on Facebook and thinking, oh, here's a cool product, let me try it out, right? But before you know it, a lot of that doesn't actually work. Sometimes only because it's not appropriate for you. Same thing with Ozempic. I mean, some people are genetically predisposed to use that well, and some people are not. So it's a matter of making the right decision. So for today, we're going to do a role play, a little different than usual. Super excited. This might be even more appropriate for my doctor colleagues out there to listen in, because you will be revealed why this product is so important for you. So I'll have each of my guests introduce themselves just briefly. We'll do that 6 or 8 minute role play, and then we'll unpack the magic of what this technology has to offer as well. So I'll start off with Michelle. Please briefly introduce yourself. Then we'll go with Peter, and then we'll go into that role play.
Yes, thank you for having me. I've been a high-risk OB nurse since the late 1980s, and I would go on to be a mom of 6 children and experience infertility, adopt 3 children into my life, become a homeschool mom of 29 years, and graduating kids out into the world. I'm down to 1. And then in 2020, I was awoken by having to end up in the COVID unit myself as a patient and the nurse who is the patient, and finding out that there were guidelines that had been set by powers that be that were going to be counterintuitive to my good outcome. So I got out of that and ended up publishing some work that helped people know how to empower themselves and know what to gather in their home, know what to have and do, and how to be a nurse and a doctor to yourself, because it was a good chance that you might not have anybody to help you, because it was a lot of information going on out there. And in doing that, I found out that one person just doing what they felt called to do could really affect a lot of people's lives and affect a lot of change just by speaking about what you felt passionate about. And now I'm on talk radio and on Nurses Out Loud Talk Radio, and thankful to be there. And I'm thankful to recognize that your suffering that you go through actually can be used for good to help others.
I love that. And thanks so much. And your voice is critically important. Like all voices are critically important, as much as you might disagree with them. That's okay too. People get too quickly offended these days about something that you don't agree with. But truthfully, honestly, I think most of the time is because they lack the information that they need to be able to make the right decision. And that's, again, the reason for this podcast. No judgment to what anybody decides. It's really a matter of, let's share the information that we believe is true, and it's up to you to decide, is it true or not? And is it applicable for me or not? That is on you. Peter, thank you so much again. And I love your title, being the health engineer. I stole that away from you just now, but yeah, what a beautiful, label, identity, super cool. So tell us briefly about yourself, and then we'll jump into that role play.
Thanks so much, Dr. Rademaker. Yeah, as a health engineer, I'm not a doctor. I don't have the full clinical experience they do, and I really wouldn't touch a patient. However, I am an engineer. I have a degree from Georgia Tech in mechanical engineering, and I've been working in medical development for about 30 years. It's my job to really be 10 to 20 years ahead of the doctor in a small area, and then to take that area, vet it from the journey from the science side of the Grand Canyon to the medical side of the Grand Canyon. That's a very big gap there, and it's my job to get those across. I've invented spinal implants and rewrote a few pages in the books of spinal surgery. I've taught how to use implants I invented over in 50 states and about 30 countries to spine and orthopedic and neurosurgeons doing spine surgery. So I've kind of seen things from a viewpoint that most people don't have. And in part of that journey, I learned how far ahead science was ahead of medicine, and wanted to bring that together even faster. And part of that was developing what would really be what now known as a functional medicine clinic, but we were doing that about 15 years ahead of everybody. And in that course of study and exploration, we found a technology called Jouvet, Juvent, and it was ahead of its time. The science was way ahead of the medicine, and it's been my job for the past 10 years. We basically took over the product's fate, and I've been its shepherd along with my brother, and we've put together, restarted the company and brought this technology, and it's by far the biggest thing I've ever worked on. And I've been given one of the highest awards by the largest medical device maker in the world. I know how to put things in context. Jouvet is clean my plate. It's what I do. And it's one of those things that when I realized, in my opinion, I could add 5 years to 300 million people's vertical lifespan. That's my number. That's not a study. I just said to myself, when does one get an opportunity to do something like that? And what the hell would I be doing better than that? But that's a big mission, and dovetails into our issue today. I met Michelle as a casual at a social at a medical conference, and she was in a walker, and I knew it intuitively that Jouvet could help her, and that's how I got to know her. And fast forward, it helped her, and that's a great story. We covered that in the last episode. I would encourage you guys to go back and watch that. But Nurse Michelle has helped me get the message out to her audience, because this, Jouvet is a rare thing. It's really the discovery of a fundamental daily requirement, and that's rare. The last one was like in the 40s, the last vitamin discovery. So I find a challenge getting it out to the clinical world. And Michelle she is a clinician, she's in the clinical world, but she also talks to clinicians on the medical doctor side, the nurse side, and also patients. And so that's been what I always request help in helping me get the word out. I can't do it by myself. And if it's you, Dr. Rademaker, and Nurse Michelle, I need all the help I can get.
All right, well, go for it. And like I said, this is a different role play today. And so just play the role that you've actually experienced, the challenge and the struggles to get other people to understand what this is, or even with Michelle. I mean, go back and forth, with that interplay of what you've experienced, because I really do want people to appreciate the challenges that are present, in this world where doctors are, quite frankly, in the trenches, overwhelmed, overburdened, on so many different levels, and simply just don't have the capacity or bandwidth or even the energy to learn something new, because, it takes a lot of work and effort to verify something. So love to hear that. And again, using this role play for the listener to potentially help colleagues out there to have a higher awareness of, that process of getting access to this technology. Go ahead.
For me, when I first heard him tell me what it was, my booth at the same medical convention had within my eye shot a person who had a vibrating plate, and it was quite a whimsical man that was there, and that you could see the plate vibrating from a mile away. It was so volatile, and children were getting on it and having a big hoopla time on it. And so I saw that happening before I met Peter, and would find out that there was something possibly that he knew about that I actually needed for a lot of reasons in my life and didn't even know it. I would never have been attracted to that particular platform that was over there vibrating so violently. My common sense as a medical professional just thought that looks like it could do some damage. And when I met him and he told me that it was a vibration plate, and I said, well, you're not that guy that was up front, were you? And he said, no. And he told me about what he had, and I went to go see what he had, and it was a completely different experience. And when I stood on it, there was no evidence of vibration, but when I stood on it, I could feel that gentle vibration going through my body. And I think, Dr. Rademaker, you have one as well, so you know what I'm talking about, the sensation that goes through your body. And there was not anything violent about it. It was very pleasant. And when he told me the science behind it as a nurse, I just was blown away to think that had a prayer been answered, that I never would have thought. I came for that medical conference for something I needed to do as myself as a professional, but I was on a walker, and I had my own medical distress at the time. So he had a solution for what I believed was going to help me recover from this hip surgery. But in a bigger scope, there was so much more that Jouvet was going to do for my body that I now am aware of. And I heard it as he talked about the science associated to osteology and what the value of a bone really is and what it really does for our overall health. Never taught in nursing school. So significant to hear that teaching.
Yeah, no, that's huge. So what happens next, Peter?
Well, it's interesting. And she brought up a very valid point. And I don't want to dwell on it, but it's worth clarifying. Jouvet, it gets lumped in together with these vibrating platforms, and it's more accurate to call Jouvet micro impact. And it's the level of energy is it's literally minuscule compared to these high energy shaking plates. And the reason that's very important is for your listeners is I'll give you a quick rule of thumb as an engineer. If you can see something moving, it's way too much energy. And I mean toxic levels. And so we're very different from that. And the reason Jouvet is so mild is because of the science. It's not hard to make in a high energy plate. It's just not safe. And so, that's the distinction there. The other thing, you had mentioned, I'm trying to remember what you made a great point, and I've lost my train of thought. I'm sorry, but the other elements, the real broad picture here is skeletal health, and our skeleton, we mistake its primary role for holding us up, and that's really third on the list. Its real job is to produce stem cells. And we know with the proper mechanical stimulation with micro impact, we can increase that dramatically. And that has such a systemic effect. And that's the message that, it's funny when you try to share it, it's fun to hear the feedback. So Nurse Michelle, tell us if you would share with us some of your dialogue with the people you've tried to share Jouvet with.
Oh yeah. So if I'm dealing with the medical community more often than I care to, because I am the patient because of just various problems. I try to avoid them, but I can't because of different reasons. And when an endocrinologist has been caring for me for decades, since 1996, it's 2024, he's known me since my first kidney stone. And the same medicine is being recommended for a condition that it's like, is there anything new you've learned? You're almost near retirement. Surely there's something new to offer me. And when I told him about the micro impact platform that I was on, he actually laughed at me. And I said, oh, no, you can't do that because you haven't read anything about this. And I went ahead and gave him a little bit more information about what it was doing. I said, don't you think of the bone as just something structural like I did? But it's where our stem cells are coming from, where our all of this genesis of blood cells are coming from. It's vital to our body's health. And I said, I think if you were to do a little lookup, you might find out something you don't know. And he actually wanted to be cocky with me and get on his computer. And he says, well, look at here. The FDA just approved something that was like a little circular thing that you wear on your back for a specific area of the bone that was vibratory, that was going to increase bone density in the spine. I said, and that's just going to cover one little area of the spine. I said, just imagine if you were standing on something and it vibrated through your entire body. And that is what it took. There were two things that happened that woke him up. That one and my persistence. And number two, the door knocked and a nurse came to the door telling him about a diabetic patient whose feet were severely ulcerated and even having maggots, and there was such a problem they were going to have to cut off and amputate that foot. And I heard it. They weren't very HIPAA protected out there, and I heard it. And they came in. I said, oh, I know it. The thing we were just talking about. I said, I just got a report this week of a patient who was ulcerated with maggots in their foot, was facing surgery and amputation, and they were on it for just a short amount of time, and that surgery has been able to be canceled. I said, look at all the information on your walls about diabetic classes. I said, are you teaching anybody about something that could bring blood flow to their foot just by stimulating the appendages of their body? And he says, okay, I'm willing to hear the information. So,
well, the big question now, does he have one?
No, he's going to have time with Peter. He's going to have a one-on-one with him.
You better make that happen.
It's interesting. I just spoke 2 days, I think 24 hours ago. I just heard from Perth, Australia, from the husband whose wife was going to have her foot. They were checking her in the hospital to amputate just below the knee for an ulcerated foot with diabetic maggots, the whole work. The pictures are, oh my God, if you look at them, it is amazing. And they heard about Jouvet and they said, well, we're going to try it. We have nothing to lose. And 56 days later, within 2 weeks, the podiatrists were saying, this is unbelievable. Keep doing what you're doing. And now we're at day 56 and we're going to try to do a full medical report on it. But this is not the first limb we've saved. And one of the secondary effects of Jouvet is improved lymphatic and blood circulation. And, it's interesting. I've been privileged to work with some of the top doctors in the world. And one of them, Dr. Heilbronn, he said, the body can heal damn near anything if it gets highly oxygenated blood flow.
Yep.
And that's exactly what was happening here. And Jouvet helps that, and that helped the foot. So either way, it's a great story, but you just see all these, so many things that go way beyond osteoporosis.
Well, Peter, you could go in and expound more on the whole stem cell, the effect that it comes out of the bone. But just to make it even a simple version from Nurse Michelle, that's what I do. I take all the heavy stuff and try to make it really simple for the people who are not medical, who are the people who need to be the recipients of these products. What is a stem cell? It is something that God put in our body that can convert to any cell in the body. And its job is to go and find the pathology in your body and convert to, like I have a heart implant. So it's going to see scar tissue. It might go and repair my heart implant. I have holes in my brain from multiple sclerosis. It may convert into, brain cells to help repair my brain cells. I have a blood clotting disorder. It can go and recognize that stem cells can convert into cells to help you before the doctor even knows that you have a pathological problem. Your stem cells are ordained to do that job. So for something to be as simple as standing on a micro impact plate that can vibrate and stimulate your own stem cells. You don't have to go get donor or autologous, because even with, I'm not sure if I'm saying it right, even with stem cells that you get from your own donation, if you are as old, I'm more than half of 100 years old, the closer you get to your death years, you know, you are making less and less stem cells, and they're older and older. So why not stimulate some new stem cells to be generated? Genesis.
Well, we
Absolutely.
can even get more basic than that. And you know, one thing that I always like to share, and that is precise language and relevant truths. And one of the relevant truths is that, you know, it takes, you know, over 20,000 years before any, you know, mutations, you know, place hold in any changes in our genetic material. So what does that mean? Well, when you think about it, we've evolved over millennia, and we've evolved in perfect harmony with nature. What I mean by that is our bodies have been responding over millions of years to all the elements in nature. And over the last 10,000 years, there's been so many dramatic changes, and especially within the last 200 years, that I can tell you right now that the body does not have the capacity to manage and deal with all those challenges. Now, one of which, quite frankly, is this, and first understand, you know, thousands of years ago, what did we do? We probably walked around a lot. We probably jumped around a lot. So basically stimulating, you know, our bony structure constantly, stressing that constantly. And there's this process called hormesis, which means that the body's strength and potential increases by any of the challenges and stresses it incurs. So, you know, jumping up and down is a stress on the bones, which causes the tissues to respond effectively to regain normal balance once again. So the truth is that what this technology is doing is recreating the normal stresses that the body requires to stay healthy. But just think about it for a moment, right? You know, we have been, this is our second recording, and you know, we've been sitting down for what, close to an hour. But we know that, you know, within 15 minutes, all these enzymes in our system start shutting down because we're sitting down. And so the truth of the matter is that you've got technology very simplistically, you know, if you just want to rely on that rather than all the other science, is that you are just recreating normal physiology. That's what the body needs. And because we are living in a world of technology that's trying to make our life so much more convenient, like nice chairs, you know, doing, you know, this video call right now, and at the same time making it super inconvenient for our health. I know you want to say something there, Peter.
Absolutely. You know, because so to your point, and I just want to buttress it, we call Jouvet a vitamin of exercise. And what we're doing is extracting one element of an exercise that's really the perfect exercise, walking. And I call it the luxury of walking. Because if you think about it, 50% of our height and 40% of our body mass are our legs. Let that sink in. That's how important they are. And the body doesn't, trust me, as an engineer, the body doesn't give that much resources to something that's not important. And if you look at these study after study where they take a group A, group B, and the difference is they're walking, the health parameters and benefits go far beyond the magnitude of the caloric output. I mean, it's so much more going on. And we now know it's that impact loading to the bone, and that's the nature's perfect form of it. So, you know, if nothing else today, your listeners, I'm going to give you a fun little mind game. Look at walking as an opportunity. When you have to walk for a long parking spot, or you have to walk back to the car to forget something, or you have to climb the stairs, don't look at it as you have to. You get to. You get to. You get to work that walking into your day. And you know what the other thing is? When I'm on the phone now, I'm just passing on a little life hack, is I put the earphones on, wired earphones, and I walk. And it's unbelievable how much more mental acuity I have when I'm walking. I'm sure there's a study on that. I'm sure there's science
No,
on that.
there absolutely is.
Absolutely. We
But
are.
what I find comical to your point there, Peter, is when people go out to the gym, they're driving the gym, and they're desperately looking for a parking spot as close as possible to the door of the gym. It's sort of, you got to be kidding me, right? And so yeah, so I totally agree with you. You know, walking is a great opportunity. Walking is a pinnacle of health. You know, we now have the sitting disease that's actually worse than a pack of cigarettes every single day. That even if you ran, I think 3 marathons during the week, wouldn't replace the damage that all that sitting does for you. Gonna give you the last word right now, Peter, and how people get a hold of you. We got to wrap it up, and then I'll go with Nurse Michelle.
Well, fantastic. You know, just to reiterate something, if your listeners today just said walking, I get to walk and not I have to walk, it's a game changer. And that's really the secret of Jouvet. And Jouvet, we're a vitamin of exercise, but a vitamin is not a replacement for a meal. It's a supplement. And the truth is, we want you to walk, walk, walk. And if you can't use Jouvet to get you back into it, but really we're about health. And at the end of the day, walking is nature's perfect, not good, perfect exercise. And running's a mixed bag, but just walk, walk, walk. And so I'll leave it at that. I very much appreciate our time here, and I really want to help people with the best clinical knowledge and forget the products. That's secondary. But at the end of the day, let's use that wonderful 4-letter word, walk.
Well, as
How
a
do people get
person who,
well, hang on a second. How do people get a hold of you?
You can go to our website, jouvent.com, Juvent, jouvent.com.
Great. Nurse Michelle, just wrap it up. Last
well,
words,
as
and
a
how do people get a hold of you?
Yeah, well, as a person who walking was not very easy because of degenerative arthritis and rheumatoid arthritis, and having family members who walking is very challenging, the beauty, what the Jouvet has given to me is the pleasure of walking. Instead of having to calculate to walk, I am getting the joy of walking back. Like he said, it is a gift. So I'm very thankful for that. I have teenagers in my home that are gross impact athletes who now know to come home and jump on the Jouvet to get some micro impact recovery. So Peter can teach about that another time. But as far as reaching Nurse Michelle, it's www.advocacywithmichelle.com, Michelle with 1 L. And I'm on americaoutloud.news at Nurses Out Loud. And it's Nurses Out Loud podcast, wherever you listen to podcasts. And I'm on Instagram, nursemichelle.rn.
Awesome. Well, I want to thank you both. And this is a great reminder that we do have the blueprint of a perfectly functioning body that's in our DNA, you know, with some snips and irregularities that, you know, a DNA profile can help you understand what it is that you can do differently. But the reality is that, you know, that DNA will be expressed well or not expressed well based on all the things that you do or do not do in your life. And in today's world, with all this technology advances, and now sitting behind computers and sitting in cars and all that kind of stuff, it's really a major challenge on our body. And in addition to all the toxins that we're exposed to, you know, the body only has a limited capacity to recover. And so with this kind of technology, which to me is a no-brainer, it's simply a vibration plate that you barely sense, but has a huge impact on your overall health. That we are obligated basically to share it with other people, the importance of this. And so definitely, once again, we're not specifically recommending anything, but we're recommending that you do your research and find out if this is right for you. So I want to thank you both for all the hard work that you do. The conversations that for many people are still quite uncomfortable, and that's okay. The only way that we make progress in this world is to have those uncomfortable conversations. You know, too many people are too easily offended. Well, the point of the matter is that I would rather be offended and be wrong about something to get the information to be right about something that can actually help me with my life or help others as well. But ultimately, it's up to us as individuals to decide, you know, what's right for us or not. No judgment. It's your decision. It's your call. So once again, Peter and Michelle, thank you so much for joining me on this podcast. My name is Dr. Bart Rademaker, and this is the Doctor's Guide podcast, raw and unfiltered, and hopefully making a difference for you. We'll be back.